What interests me about Erickson is that he was a radically experiential psychotherapist. And one of the things that I try to teach my students is that when you have an important idea, an idea that you want to reach your client with impact, then one of the things that you can do is to create an experience, to present that idea gift-wrapped within an experience. And this is done in order to activate the patient so that you empower this idea by creating it into an experience. Now, Erickson was so radical that you could watch an entire session, and during that session, he did not get didactic. His therapy was not about psychoeducation. He was not commenting on. He didn't comment on the history. He didn't comment on the relationship pattern. He didn't comment on the affect. When you were with Erickson, as a student or as a patient, it was like Erickson was tossing experiences into your lap. You would catch these experiences, and like a metaphor, the experiences are ambiguous, but they give you a felt sense of being in a different state. And one of the things that was singular about Erickson was helping people to develop adaptive states that would help them to cope with some of the exigencies of living. And we could say that psychotherapy happens when people get into inflexible states, unadaptive states that can't adequately cope or change their orientation to their circumstances. Let me give you a simple example. I met Erickson 40 years and 2 months ago. This is 1973. It's my first day there. Erickson is 71 years old at the time. I think I'm 26 years old at the time. I have my master's degree. I'm a licensed marriage, family, and child counselor. I have a little experience. It's not that I'm bereft of experience, because I had worked in psychiatric units as a mental health worker. I was adept and interested in working with schizophrenic patients. At the time, I was a therapist at a subacute treatment unit. So I had some experience, some skill sets. So I'm with Erickson. He draws 3 lines on a piece of paper. One of them is vertical, one of them is horizontal, and one of them is diagonal. And he says, "What's this?" And I'm trying to look at the lines and trying to make sense of this. It must be some pattern in there. It must have some kind of deep meaning. And finally I give up, and Erickson goes, and then he says, you watch your patients, you don't necessarily listen, you don't necessarily believe what they say to you, you look for confirmation. Now, if as a student at that time you would have said, Jeff, as a young therapist, a good thing to do is to pay attention to minimal cues and incongruities in behavior, I would have written down in my notes, pay attention to minimal cues and incongruities in behavior. I never would have looked at those notes again, and I wouldn't be able to recount that more than 40 years later. But when he took the idea and turned it into an experience, which was, it was radical in Erickson, make everything experiential. I could give you many other examples, if you want them, of things that Erickson did where rather than saying it, he presented it as an experience to enliven the moment.